So complex trauma could mean a range of different traumas, as we've already talked about. But usually when people are saying complex trauma, they mean that there have been multiple different traumas and adversities in that young person's life. And of course, that can have a really profound effect on all aspects of their life, including mental health. So in the UK, we have some really nice epidemiological work done by people like Andrea Denisi at King's College London and his colleagues that have looked at the experience of these more complex, often interpersonal traumas on mental health outcomes for young people living in the UK. And here what we find, consistent with a really broad literature, a broad international literature, is that young people that have experienced complex trauma are at particularly elevated risk of a range of mental health outcomes. PTSD is one, that's a trauma-specific mental health outcome, but they are also at high risk of depression, anxiety-based disorders, conduct difficulties, potentially substance abuse in later adolescence, concerns like self-harm behaviour. So all of these outcomes are elevated in young people that have experienced complex trauma. So it's incredibly important that when we know a young person has experienced these early complexities or complex traumas and adversities, that we're making sure we're keeping an eye on their mental health.